Because the heavily hyped swine flu scare last spring did not turn out to be such a big deal after all, some people are cynical about the possibility of a major outbreak this fall. But the state health department cannot afford to take any chances. News 13's Jim Winchester reports that agency is already moving to deal with the threat.
We've been doing planning since the spring.
That's when the swine flu scare shut down some schools and dozens of New Mexicans with symptoms were tested. Hospital emergency rooms were put on standby for a major outbreak. But the H1N1 virus wasn't as bad as first feared. But it still has not gone away.
What we're doing is monitoring hospitalized cases. I know we've had at least 20 hospitalized cases in New Mexico, and then we just had our first death. And that was somebody who was in that high-risk category.
That death was a 45-year-old woman from Sierra County who had other medical complications. But with flu season just around the corner, health leaders and others are being educated on swine flu prevention, protection, and protocol. That includes schools.
Just guidance to schools about how to look for sick kids, keep them out of the classroom, same with staff. We're going to avoid closures unless something changes with the severity of the disease.
Meanwhile, seasonal influenza vaccines are ready for the fall flu season, but special H1N1 swine flu vaccines currently under development will likely be shipped in mid-October. They'll at first be available for high-risk patients, including pregnant women, children, healthcare, and emergency services personnel.
We'll be able to finalize the details once we get better information from the federal government. But I think we're as ready as we can be at this point.
And the same prevention tips released in spring apply right now. Wash hands frequently, cover your cough, and stay away from sick people. Dick, back to you.
All right, Jim, when swine flu vaccines do arrive, health agencies plan to announce vaccination clinics across New Mexico.